Hello friends! Welcome back to my channel. The irreplaceable Jasi is with me, Jahnavi. So today is my first vlog on my channel. నేనైతే చాలా excited ఉన్నాను. Vlog దేని గురించి అనుకుంటున్నారా? It's about physiotherapy in USA. స్టార్టింగ్ ఫెబ్లో నాకు రిస్ట్ ఫ్రాక్చర్ అయింది. ఐ గాట్ స్లిప్డ్ ఆన్ స్నో అండ్ ఫిజియోథెరపీకి వెళ్ళలేకపోయాను కరోనా సిచ్యువేషన్స్ వల్ల. నా ఇంటలెక్చువల్ బ్రెయిన్ యూస్ చేసుకొని ఎక్సర్సైజ్ చేసా, బట్ ఇట్స్ ఆఫ్ నో యూస్. సో ఫైనల్గా కొంచెం ధైర్యం తెచ్చుకొని ఐ స్టార్టెడ్ గోయింగ్ ఫర్ ఫిజియోథెరపీ. సో నేనేమనుకున్నానంటే ఎవరైనా ఫిజియోథెరపీ సెషన్స్ చేయించుకోవాలి అనుకున్నా ఆర్ సేమ్ రిస్ట్ ఫ్రాక్చర్ నా అలాంటి సిచ్యువేషన్స్లో ఉన్నా నేను చేయించుకునే సెషన్ని అండ్ మేబీ నా ఫిజియోథెరపిస్ట్ని అడిగి కొన్ని బేసిక్ ఎక్సర్సైజెస్ వాళ్ళు ఇంట్లో కూర్చొని చేసుకునేవి నేను చూపిస్తే కొంతమంది కన్నా హెల్ప్ అవ్వచ్చు అని ఐ స్టార్టెడ్ మేకింగ్ దిస్ వ్లాగ్. అండ్ ఇంకెందుకు డిలే, లెట్స్ గెట్ స్టార్టెడ్. కమ్ ఆన్.
టు ఎన్ష్యూర్ సేఫ్టీ ప్రతి ఒక్కరికి ఎంట్రన్స్లో టెంపరేచర్ చెక్ చేస్తారు. సో వీడియోలో చూస్తున్నట్టు స్టార్టింగ్లో కొన్ని వార్మప్ ఎక్సర్సైజెస్ చేపిస్తారు బిఫోర్ ద యాక్చువల్ సెషన్.
Hi Greg.
Hi.
How are you doing?
Good. Nice
Good?
to see you.
Nice to see you too.
Yes.
So, do you still remember the Namaskar pose I taught you last time? Can you address our audience?
I can. Namaste.
Oh, that's cool. Before getting started, can you give us a short intro about yourself? Like, how long have you been doing this and stuff?
Yeah, so I'm a physical therapist originally from the Upper Peninsula of Michigan, so in a small country setting, and I've been doing this for, a couple years now.
How physiotherapy can actually help a wrist fracture? Is it mandatory for people to get it?
Not always, but what can happen is after a wrist fracture, you're stuck in a cast for, 6 weeks, 8 weeks, maybe a splint for part of that. So a lot of people lose strength and range of motion or movement in their wrist during that time. So depending on the severity of the fracture, how they feel once they get out of the cast, it's not always required, but it really just depends person to person. Yeah.
Can you also show us some basic exercises? Maybe people who are not really willing to come to physiotherapy session can just sit at home and do some basic exercises.
Yeah, so these exercises would all be for after you're done with being out of the cast. So you would want to make sure you get clearance from your doctor for movement and range of motion and all of that first. But basically, a couple simple ones would be where you work on wrist flexion and extension. So for the wrist flexion movement, if you're lacking flexibility that way, you would kind of grasp your loose fist here with your other hand and try to straighten. When you get in that position, you'd hold it for about a minute or so, maybe a little bit longer. The opposite direction you can work is wrist extension if you're limited that way, and that's trying to push this direction to feel a similar kind of stretch. In these stretches, you shouldn't feel sharp pain, but it may be a little uncomfortable if you just have a lot of stiffness in the tissue surrounding the joint. In addition to those, you can work on strength. You can have a small weight or anything around your house. You can do wrist extensions with it, wrist flexion with it as well. And you can also do kind of side-to-side movements like this to work on pronation and supination of the wrist. The concept is that we wrap it around, and then you kind of get it hooked around the wrist. Okay, just if you're moving the wrist, it's just at the point where it's not moving much, and then what that's going to do is it's going to pull your radius and your ulna forward, and basically that's, you wouldn't do this if everything's healed up. That's when you do this exercise, but it's going to pull the radius and ulna forward while you keep the carpal bones in your wrist stable, and you can kind of lean forward into it. What that's going to do is just increase the stretch and kind of create a little bit of a joint glide to help to improve that range of motion.
So how often they should be doing these exercises?
Yeah, so the stretching you can do every day, multiple times a day, 2 or 3 times, for about a minute or so each stretch. And if you're seeing improvement, you can even do them more. It's not going to hurt. For the strengthening exercises, because they're kind of lighter impact exercises, you can do them once a day, maybe about 20 or 30 reps or so of each. And then for the same thing with the strengthening exercise. So every day you can work on them after, but you just got to make sure you get clearance from your doctor that you're allowed to start doing things that the fracture is fully healed. If you do these stretches and exercises too early when the fracture is not healed, that would be not indicated to do so.
Thank you, that's really helpful. Shall we get started for the actual session?
Sure. All right. So as part of the session, in addition to some of the exercises that we would do in therapy for it, we also work on trying to improve wrist mobility through manual therapy or hands-on therapy. So some of the things I'm working on with that are called joint mobilizations. So with those movements, I basically grab one part of the joint and then I get over to the next area and I work on trying to do mobilizations where I shift the bones that are distal or further away than the bones that I'm stabilizing to try to improve movement that way. We would work on this for a little while in different directions. And then from there, I would kind of provide tractional movements where I pull the joint surfaces away and then add range of motion to it. Very nice. Where we're just trying to get...
Is it natural?
Oh yeah, for sure. That just means that you had a little air pocket in the joint.
Okay.
It might be a little painful, as you can see that it's making her a little sore.
Do you think it's getting better? Is there any improvement in the wrist area?
Let's see. Compared to the first day you were in, I'd say yes.
Oh, okay.
This way's still pretty tight.
Yeah? And it still hurts me?
Right. So usually I do for about a half hour where I stretch.
Greg, thank you so much for the session so far, and I just have one last question for you.
Yep.
Why team rehab physical therapy?
Yeah, so there are a lot of clinics around. I myself have worked at a different clinic prior to working here, and the main difference is that they put a lot of work into making sure they get people to work here that are passionate about being here and put a lot of effort and time into being the best they can be at this profession. It's really about the people that are here, the staff that are here, and what has been built with this company is just an environment where people are able to thrive, able to get better, able to improve, and they encourage that from the top management all the way down. So it's a good company for as an employee, and
Thank you so much again.
No problems.
ఈ బ్లాగ్ మీకు నచ్చిందని అనుకుంటున్నాను. నేను ఇనిషియల్గా ఈ ఛానల్ స్టార్ట్ చేసినప్పుడు ఎడ్యుకేషన్ మీద ఫోకస్ చేశాను. నేను అలాంటి కరెంట్ న్యూస్ అప్డేట్స్ని సైడ్ వర్క్గా చేద్దాం అనుకుంటున్నా. అండ్ ఫ్రమ్ నౌ ఐ వాంట్ ఫోకస్ మోర్ ఆన్ ద వ్లాగ్స్. మోస్ట్లీ దేని మీద ఫోకస్ చేస్తానంటే లైఫ్ స్టైల్ ఇన్ యూఎస్ఏ. ఆబ్వియస్గా మనందరికీ ఉంటుంది కదా, యూఎస్లో వాళ్ళు ఎలా ఉంటారు, మన వాళ్ళు ఎలా ఉంటారు, ఇక్కడ వాళ్ళ లైఫ్ స్టైల్ ఎలా ఉంటుంది అని చెప్పి. సో ఇక్కడ ట్రావెలింగ్ వ్లాగ్స్ చేద్దాం అనుకుంటున్నా, షాపింగ్ వ్లాగ్స్ చేద్దాం అనుకుంటున్నా. అండ్ మీకేమన్నా యూఎస్లో పర్టికులర్గా కొంచెం క్యూరియాసిటీతో ఏమైనా తెలుసుకోవాలనిపిస్తే యూ కెన్ ఆల్సో కమెంట్ సెక్షన్లో. నేను అన్ని కమెంట్స్ తప్పకుండా చదివి ఐ ట్రై టు మేక్ సమ్ వీడియోస్ ఆన్ దాట్ ఆల్సో. అండ్ నా నెక్స్ట్ అప్కమింగ్ వీడియోస్ అప్డేట్స్ మీకు రావాలి అంటే ప్లీజ్ టు సబ్స్క్రైబ్. దట్స్ ఇట్ ఫర్ నౌ అండ్ stay tuned to my channel, The Irreplaceable Jassies. There are many more videos to come for you guys. Antwarku, it's me Jahnavi signing off. Bye-bye.
What are you waiting for? Please subscribe and click on the bell icon to get more interesting updates and notifications from The Irreplaceable Jassies. Thank you.